Hi everybody, it's Adam, the geneticist and genomic data scientist from Verdure Healthcare. And I would love to welcome you to my 9th chromosome talk, and it will also be involving the cancers on the face. Right, so let's get started. So, as you might know by now, chromosome 9 is the 9th largest chromosome in the human body. So when we line up all the chromosomes here, this would be its position. Okay? And chromosome 9 actually makes up around 4% of our total genes. Furthermore, what is the difference between chromosome and the genes again? Alright, you should be able to answer this question. So, alright, but anyway, I'm going to give you a refresher. Chromosome is basically a pack of genes. So as you can see, it's like a ball of strings. When you pack all the genes together, it becomes the chromosome. And even within our genes, there are only 4 ingredients, G, C, A, and T. And if, let's say, we have something wrong with these G, C, A, T, or the combination, duplication of some of these codes, it's going to cause a bit of a problem. Okay, so chromosome 9 has around 138 million DNA pieces, and I've aligned them up here for you, so the mapping of the genes. So within chromosome 9, there are around 6 major diseases, and these are going to be discussed in detail one by one. Alright? Okay, so let me just give you a bit of a refresher before we get started. The so-called genetic disease are actually separated into 2 major types. The first one would be single gene disorder, whereby just only one or around 1 or 2 of these GCATs, their orders have been mixed up, duplicated, deleted, or substituted. For chromosomal abnormalities, whereby the entire chromosome, for example like chromosome 9, there's a big chunk being missing, duplicated, or swapped around. So that will be more serious in terms of its effect. Okay, so the first disease I'm going to talk about is the chronic myeloid leukemia. In short, that will be CML. So when you hear the word leukemia, it is actually a blood cancer. Okay? So what do you think of when you hear the word blood cancer? Extra white blood cells? That's the most common type. Right, so this is a cancer that affects the bone marrow. It's the spongy part within the bone, right? That looks like a beehive. So this spongy part is responsible for making our blood cells. Okay, so if there is something wrong with this particular gene, it's going to cause the white blood cell, the amount of them, to increase. So as a result, it causes blood cancer. And the possible symptoms could be bone pain, right? So bone pain can be something very serious, and it can be very irritating. Easy bleeding, right? So when you have just a little bit of a scratch, then you're bleeding non-stop. Feeling full after eating just a small amount of food, or feeling run down or tired. Yes, because if, let's say, the amount of white blood cells actually takes up a larger percentage, right, at least compared to the red blood cells, you're not going to have enough oxygen. So you will feel tired very quickly. Fever or weight loss without even, out of no reason, you don't even try to want to manage your weight, but you have lost some of them. Loss of appetite or pain or fullness below the ribs on the left side, okay? So around here, if you feel pain or fullness, then you should be very careful about this. Excessive sweating during sleep or night sweats is also one of the symptoms where you're getting chronic myeloid leukemia, CML. So if you have a mutation within this gene, it's not a necessity that you will be getting CML, it's just that there is a higher chance of you getting it. So after genetic testing, if you do have a mutation in this chromosome 9, and particularly on this CML gene, then you should watch out for these symptoms. So let's move on from CML. So the next disease that we're going to talk about is also a type of cancer, right? It's called the Gorlin Syndrome. Okay, so the Gorlin Syndrome is also known as the Nevoid Basal Cell Carcinoma Syndrome. Now, the key is to hear the word carcinoma. At the moment you hear this word, you can automatically think of it as a kind of cancer. Carcinoma is in fact a kind of cancer. So it is a condition that affects many areas of the body because there is no fixed syndrome. Even though two individuals, A and B, individual A and individual B, if they both have Gorlin syndrome, even assume that they are boys, they can actually get a very different kind of symptoms. Okay, so it increases the number of tumors. It might not necessarily be cancerous tumor, but just the very distracting lumps and bumps over the body. Okay, and a lot of these lumps and bumps and tumors, they usually grow from adolescence. Okay, meaning from early adulthood. Right, and these cancers, they most likely going to appear on the face, on the chest, and also the back. Right, if you can have a look at this particular chart over here, so usually they will be having some injured look like kind of symptoms on the face, all right, because of these tumors, right, and it is really not something nice to have. Okay, so moving on from these two cancers, we have Fredericks Ataxia. All right, ataxia is something to do with the neural system, all right, neurological system. So it is in fact a progressive, meaning to say from less serious symptom to more serious symptoms as you grow, as you age. So it's a neurodegenerative movement disorder with a typical age of onset, meaning the starting time around 10 to 15 years old. Okay, so the gene responsible for this particular disease, Fredericks Ataxia, is FXN. Okay, it's a gene called FXN. So if you do have a mutation on FXN, and it is a lethal one, not just a kind of accidental one, and it's not even lethal. If let's say if it's a pathogenic one, so-called, then you will be having the Fredericks Ataxia. Okay, so the initial symptoms, the symptoms can be unstable posture, because even though when you stand here, you will still, be like, oh, I'm feeling very unstable, I'm going to fall, because it is, once again, a neurodegenerative disease. And also progressively difficult in walking due to impaired ability to coordinate. So remember, our hand-eye coordination, our leg coordination relies on our neural systems. All right. So now, what's ataxia? It is the ability to coordinate. All right, to coordinate the movement is called the ataxia. Okay. So affected individuals, okay, when they start, they are most likely going to have a slurred speech, meaning to say they can't speak clearly. Sometimes foot deformities, and then sometimes irregular curvature of the spine, whether it's an S shape or basically forward, the curvature, something like that. All right, and also be careful because the Fredericks Ataxia is also associated with cardiomyopathy. So it's a disease, it's a heart disease that leads to heart failure or irregular rhythms of the heart. It's called the cardiac arrhythmias. All right. So about a third of people having Fredericks Ataxia, they will be also having diabetes, and it's the diabetes mellitus. Okay, sorry, diabetes mellitus. All right. So moving on from that, we will go back to cancers right now because I've been putting these diseases in alphabetical order. So moving on, we'll talk about malignant melanoma. Okay, so malignant is something nasty. Melanoma, okay, noma, this word. What does it come to? Carcinoma, leukemia, melanoma. They are all cancers. Alright, so this is a kind of skin cancer, whereby it is actually not that easy to be diagnosed, because initially it can be just like a dark spot on somewhere around your body you might not even notice. Alright, it could actually be something else instead of cancer, but if you do have a genetic screening which shows that you have a skin cancer gene, then you need to look out for these black spots. Alright? Okay, so these black spots initially, at least at stage 2, they are not very dangerous at all. But if they grow, okay, if this thing grows, it can be very serious because it can be spread to other parts of the body. Okay, so as you can see, these are just very regular kind of like black spots. So this is T0, meaning to say the stage is 0. But after 18 months, you can see there is not much difference at all. But instead, it is growing deeper into the skin, and through the bloodstream, it can have this cancer can go and spread to other parts of the body. So you need to control this at an early stage if you're diagnosed via genetic test to have skin cancer genes. Okay, so moving on from that, we have the Tangi disease. Okay, the Tangi disease. Now, what is that? What exactly is that? Whereby, if you have Tangi disease, the good cholesterol in your blood, it's going to decrease significantly. Okay, so the good cholesterol is called the HDL, whereby if, let's say, without these good cholesterol, then the so-called bad cholesterol, LDL, it will start to grow. Okay, you're going to get a very unbalanced ratio between them, and as you can see, this is the blood vessel, and if there's a huge amount of bad cholesterol in there, it will block your blood vessels. Okay? Now, the most important thing is that this is characterized by enlargement of the liver, okay, the spleen, lymph nodes, all right? All of these are the most common kind of symptoms. If you can see them, then you need to be careful, especially when you've done a genetic test and it comes out that there is a gene that is mutated that is most likely going to cause Tangi disease, all right? Okay. Right, so moving on from Tangi disease, once again, tuberous sclerosis, all right? Tuberous sclerosis, whereby it is very similar to one of the disease. Now, I'm going to give you a little test over here. Okay, so this is also a kind of disease which can let your body grow tumors over the skin. Okay, over the skin, but it's not skin cancer, it is the lumps and bumps. So what kind of disease is that we've talked about that is similar to this one? Okay, but most likely these are non-cancerous. But you see, if out of 100 lumps and bumps that you have, one of them is cancerous, it will be life-threatening enough if you don't take care of it. Okay, and they will grow all over the body, not just the face, not just the chest, not just elsewhere, but over the entire body. Okay, so but the thing is that tuberous sclerosis is present from birth. Okay, so although it might not cause, obvious problems immediately, but for example, one of the most common place where this thing will grow is on the eyelid. So even though it's not cancerous, but when there's a tumor on your eyelid, basically you can't see, and it will severely affect your self-esteem. So as you can see, genetic diseases is really not a joke. So it's better off to prevent them all. But okay, if let's say some of you might still be asking me, Adam, is there any cures for genetic diseases? Well, there are certain ways which you can try to cure genetic diseases, but it might not work very well. It can control the symptoms a bit, but it will never be fully cured. Okay, so one of the therapies, the gene therapy, which is to cut out the the mutated genes and replace that with the correct one. But that is more of a science fiction rather than a practical solution. Okay, and not every piece of gene can be done in this way. All right, so remember, DNA produces protein. Okay, so all of these meats and fleshes are protein. So then if, let's say, this gene is affecting a particular protein, we can try and do a protein replacement therapy, but still it is not going to cure from the root, even if there is a solution. So sometimes, okay, the genetic diseases, they will only affect the metabolic function in the body. For example, if the body cannot actually take care of certain chemicals or balance out the hormones in between the body systems, then we can do something called the diet modification, or there are certain pharmacological agents that can help you do the control. But still, there are so many kinds of genetic diseases, it's best not to put your bet or put your money on these therapies. Okay, or if, let's say, for example, the bone marrow, just like the blood cancer we talked about on the first disease, we can pretty much do a transplant. Okay, we can do a transplant, but once again, it is a very difficult solution to begin with. Okay, so the best thing to do is to get yourself genetically screened before you have the baby, because we all can have certain genetic diseases which we don't know about. So at Verdure Healthcare, we do provide something called the pre-pregnancy DNA screening. Okay, so as you can tell from the name, it is part of the pregnancy preparation, whereby back in 2015, the University of Chicago, the number 9th university in the world, so that's a very high status, they are saying that humans carry at least 1 to 2 lethal recessive mutations on average. And when humans carry on average 1 to 2 mutations, that if inherited from both parents, it can cause a severe genetic disorder or death before reaching reproductive age. Now, the so-called reproductive age in terms of biology is at 15 years old, not 18 years old. 18 years old can be a legal age in many countries, but biologically speaking, it will be 15 years old. So it's a very short lifespan. Report scientists from the University of Chicago and Columbia University. Now, Columbia University is also a very famous university in the US. Okay, so both of these universities together, they link up to make this discovery. It is very scary, but at the same time, we can now be aware that, okay, why are we having genetically defective babies when the parents are fine? So because we ourselves, even me, when you're looking at me right here, I could be a carrier of any genetic diseases, okay? You don't know unless you get a test. Alright, so with our Verdure Healthcare pre-pregnancy DNA screening, we have 2 parts of the report. The first part is to line up your chromosomes. So we are looking at this big picture first, okay? So from the first pair of chromosomes all the way to the 23rd pair, which determines your gender, alright? So if you have an X chromosome and a Y chromosome, by now you should know what gender that is, okay? If you haven't known about it, please go back to the introductory videos. So, if we were to line up your chromosomes, what are we looking for here? What are we going to see? So, we're going to see, of course, I hope everything is normal, but when we see deletions, meaning to say that supposedly this is the normal chromosome, but there is a big chunk missing, then it will be significantly shorter compared to the normal chromosome. Alright? And so friends, you don't need 2 chromosomes to have an issue in order to really have a problem. Okay? Just one of them is enough to cause a problem in this scale. So duplication, meaning to say that assuming this is the normal chromosome, in the middle there's this one small part, okay, that has been duplicated unnecessarily. It's going to elongate the entire chromosome, and that's not good. Inversion. Now, this is, I believe, one of the least lethal situation that can happen whereby, okay, so assuming this is point A, this is point B, it has flipped around. So instead of AB, it's BA, something like that, all right? But this is just an example. So it basically has flipped around. Whereby substitution, you see, this is chromosome 4 as an example. It can happen on any chromosome. And this is chromosome 20, for example. So something from chromosome 4 has actually gone to chromosome 20. Yes, it can happen this way. Why? Science is still investigating. I can't give you a firm answer right now, but we, even at Verdure Healthcare, because a lot of couples, they come in, they complain to me that, Adam, we have been miscarriage, we faced miscarriage for a couple of times. I do a test on there with them, and we see these situations. All right, so in that case, these substitution and also the next one, translocation, will most likely cause miscarriage. Why? Because you see, this is, for example, chromosome 4, and this is chromosome 20, okay? So they have swapped around, all right? So this is single way, one-way ticket where chromosome 4 has gone to chromosome 20, but this way, chromosome 20 and chromosome 4 swap their materials. So can you imagine if, let's say, the parent has given away this swapped part and combined it with the spouse's normal chromosome, it is still going to generate an incorrect amount of genetic information. Okay? So you might have a question, Adam, if that is the case, wouldn't this husband or wife, him or herself, have a problem? Can't you see that through him? No. Why? Because as long as we do have the correct amount of genetic information, you will not see anything wrong with this individual. So the only way to find out is via a chromosome lineup. It's called karyotyping. Okay, now that is just report number 1. Report number 2, or the second part of our report, would include looking into specific diseases. All right. So how do we do that? We're going to zoom in to the chromosomes, and we're going to read your genetic codes to see if you have, any of the diseases that we just talked about, or even in my future series or in the previous series. Regarding these genetic diseases. So all in all, we have included for you 420 genetic diseases. Let me repeat, 420 genetic diseases. All right, and the way how we screen them all out, okay, is via something called the next generation sequencing. And this next generation sequencing is a lot of work, as you can see on this graph here, which I wouldn't go into detail. But basically, from the sample gene, we are extracting all the genetic information about this gene. All right. When data are generated, okay, what's going to happen is that there will be a genomic data scientist, or formerly known as the next generation sequencing data scientist. All right, we'll sort out these data using a lot of computer programs to generate a functional report, which we can analyze and tell you whether or not you should go for IVF because you need genetic selection for the embryo, or you can go ahead with natural pregnancy. Okay, so this is one of the sample reports. So this lady over here is the wife. She has something called the beta thalassemia, Smith lamniopis, and the Wilson's disease. Okay, she's carrying 3 diseases with her, but very fortunately, her husband is carrying alpha thalassemia. So even though beta and the other one is alpha, so they are not going to affect each other. So very fortunately. Okay, so they can go ahead and get pregnant. But the thing is that, okay, if assuming the wife is carrying beta thalassemia and the husband is also carrying beta thalassemia, there is a 1/4 chance, meaning 25% chance, that the baby will literally be affected by beta thalassemia. And that is a very serious kind of disease even within the thalassemia sickness. okay, half of the chances, meaning to say 50% chance, they will be carrying, you know, the beta thalassemia gene with them, and only 1/4 chance that the baby can escape completely. So even though there are a fair amount of chances, but let me ask you this question. Are you willing to gamble your baby's health, or even potentially his or her life, with 25% chance? Right? I'm sure you have an answer already. Okay. So that is why when you seek a genetic test, you must see a professional, okay? So sometimes when you see commercial genetic tests being sold on the internet, something like that, which I will go into details in a while, they are only used for wellness and they cannot make clinical decisions, all right? So let me introduce myself, what are my qualifications in that case. So I am graduated from the Royal College of Surgeons of England. I have received a professional qualification that's called the Postgraduate Certificate in Surgery. All right, so I'm qualified as a surgical instructor. I'm able to teach surgery. It's just that I don't right now. Okay, but even though you get qualifications like this, it's still not enough for me to speak to you about genetics, because we have a medical base for myself, the surgical instructor, but if you want to talk about genetics, all right, you have to get one more qualification, and I've obtained this from Stanford University School of Medicine, with their Stanford Genetics Genomics Certificate, and I'm qualified as a geneticist by this university. But somehow, the regulations are getting more strict, especially when we follow American guidelines, whereby if we were to offer you genetic tests, we have to be trained in offering genetic tests. Not just only that you need to be qualified as a geneticist, but you also need to have specific qualifications about genetic tests. And I've obtained this from Harvard Medical School in genetic testing and sequencing technologies. And furthermore, like I've told you just now, all of the sequencing technologies, they will generate a bunch of data, and you need a data scientist to sort them out. So I'm qualified by Johns Hopkins University with the specialization in genomic data science, all right? So with all of these knowledge, I'm very confident that I'm able to tell you, using a genetic test, of how you should proceed in order to reduce the risk in having a genetically ill baby. Okay, so commercial genetic tests. Okay, if you open up YouTube, sometimes there are certain companies which will advertise and say that, oh, okay, they have done a certain amount of genetic tests, now I'm feeling fit and healthy. So as you can see, these genetic tests are for wellness. Okay, what kind of exercise should you do? What kind of food should you eat? And I've seen certain advertisements to also tell you, based on your genetic profile, which career should you be developing in? Okay, so I mean, okay, just to be straightforward, if there's something wrong with the result, it's not going to be life-threatening. But clinical genetic tests are much more serious than this. Okay, just like our pre-pregnancy DNA screening, because we need to base our fertility solution on this test. That's why it has to be that we have to take samples from your blood, okay, from the arm over here, whereas compared with commercial DNA tests, you only need the saliva, right? And step 2, after the genetic test, after when I analyze the results for you, we'll need to enhance your quality of the sperm and the egg cells, okay? Whether or not you should go for IVF or natural pregnancy, for both ways you should enhance the quality of the sperm and the egg cells. And with that, we have a couple of award-winning fertility supplements, which has won the Reader's Choice Award 2021, given by Baby Talk and Mama Papa magazine. It's a very large media company. And oh, I would like to use this chance to thank you very much for that as well, because without having consumers voting for us, we'll never be able to get such a prestigious award. So our VHC Formula female 1 and female 2, they are pinpointing at the ovulation health, okay, and also the quality of the eggs. So these are the things that have been pinpointed by VHC Formula female 1 and 2. And for male, we do have the VHC Formula male, okay? So it enhances the quantity of the sperms and also the quality in terms of the shape, known as the morphology, and also the swimming capability, known as the motility, all right? So, and furthermore, we have the VHC Formula Confinement package, whereby this is specifically for you to recover after labor. All right, after the baby is born, you need to recover in full, not just only in one aspect, in full, holistically, so that you are better prepared for your next baby. Okay? Right, and also because of our honesty and our business model of helping couples get healthy babies, we have also won the Superbrand Award from the UK. Okay, so this is a UK awarding body. So we've won the Superbrand Award, or more formally known as we are designated to be Superbrand. And within this judging panel, there are 3,000 judges. So I would love to say an extra thank you to you all supporters. Without your support, we will never be able to, have the status. Okay, so the third step is to literally go for natural pregnancy or the IVF. But IVF is not just the normal one, but you need to add in something called the pre-implantation genetic screening, or known as the pre-implantation genetic diagnosis. I'll go into those in detail. For natural pregnancy, okay, we have something called the home artificial insemination IUI, whereby all you need to do is IUI at home, very convenient at your own time. You just need to follow 3 steps, all right? Do the chart your menstrual cycles, okay? Test your ovulation, use the kit, the IUI kit, to transport the sperm directly into the uterus, and there is a huge chance that you will get pregnant during that cycle. All right, so let me go into details. So first of all, you will be, when you purchase this package from us, we will give you a very nice looking chart for you to track your ovulations, to track your menstrual cycles. So what are we looking for here? So when you ovulate, there is a bump in the body temperature. Now, just a very small bump. That's why we need to use Fahrenheit thermometers, so that you can see, oh, okay, this is the time of the month where there is an ovulation window, and keep on charting for the next 2 months. And if you can actually spot a pattern, around which time of the month, then you will be able to use, this is called the LH ovulation test, literally ovulating. When you are literally ovulating, you can use this kit that we've imported from the US. It's called the IUI kit, whereby all you need to do is to assemble the kit, all right, assemble the hose, and at the same time, on the same day at least, ask your male partner to produce a sperm sample. And during the time when you're convenient, you need to use the syringe to take up your partner's sperm cells, and using the component, it's blue in color, connect that with the syringe, and you will be able to inject the sperm into the uterus directly. So it's literally a shortcut. So this is especially suitable when you have anxiety. Okay, so a lot of guys, because they feel responsible for making their wife pregnant, during the correct time of the month, when pressure comes, everything just wouldn't work accordingly. So with this, it is a very good psychological support. Of course, if you decide to use the most natural way of having the baby, please by all means do so. But this IUI kit is especially suitable for people with lower sperm count, poorer sperm motility, and also poor sperm shape. But of course, if you are having all these symptoms, we would strongly suggest you to build the quality of the sperm with our VHC Formula male first. And for ladies with high amounts of antibodies or recurrent genital infections, or sometimes pain during the intercourse, this would also help significantly. Now, pgdpgs. Some couples ask me, Adam, why don't we just go straight forward to go to this PGS, PGD, go for IVF, and so that we don't have all these trouble. Okay, it is not without trouble because PGS, PGD cost you a lot of money. That's only one problem. Okay, but basically, let me explain how is it done. When you go to the doctors, the IVF center, you decide to take up the treatment, you inject yourself with stimulating hormones to generate more eggs, you go back to the hospital, doctors take your eggs, and they will inject that with the sperm that your husband will be producing a sample of on the day. And after around 5 to 6 days, okay, before they were to freeze your embryos, you get to select whether or not you want to go for embryo genetic selection, whereby if you do, what's going to happen is that they will take, okay, one bit of the cells from your embryo to go for the genetic testing to see whether or not you have, to see whether or not the embryo has genetic diseases. Okay, so this is what it looks like. Okay, so this is, the scale is correct, but of course this is a drawing. This is the embryo, the needle will poke in and take one of the cells. Alright, so the nature of this action itself will more or less hurt the embryo, and then it will literally lower down the chance of success within the entire cycle. Okay, so when we talk about money, go to Google and search cost of PGS PGD in Malaysia. You can easily find out that an estimated cost with IVF and PGS PGD, the PGS PGD action itself can top out 35 to 50,000 on top of your IVF costs. Okay, higher cost, lower chance of success. I'm sure you'll be able to work out the math. But the thing is that if you really do have genetic diseases be carried in your body, and especially when you and your partner has the same carrying disease, then you will really need PGS PGD. So that is why, even if that's the case, we still strongly suggest you to pump up the quality of your sperm and egg cells, hopefully that the embryos will be able to survive through this process. Okay, so Verdure Healthcare is a company with a huge amount of network, although our size is not very big, but our network is. Because we work with PathLab, we work with BP, okay, these are, I'm sure they need no introduction. We also work with 2 genetic testing labs, genomics and DNA laboratories. We work with Alpha Fertility Center, TMC, Sunway, Thompson, all of these are the most famous IVF centers in Malaysia. Sonovision is like BP, except they are experts in providing ultrasound services. And Gribbles, they are just like PathLab, they provide blood tests. Okay, so one last thing. I just want you to remember that your genes will determine your baby's lifetime health, right? So as I mentioned before, the cure to genetic disease is more like a fiction rather than a practical solution. So that is why we need to prevent them from happening. So with that being said, I thank you so much for your attention today, and I really hope that my session, my talk can actually help you gain more knowledge in genetics. Alright, this video will also be put on YouTube, so please do support us by liking our video, share it with our friends, your friends and family, and also to subscribe to our YouTube channel so that you will get the latest news about fertility and genetics. Thank you very much. I'll see you next time.